Welcome to the second part of our lecture on the luteal phase of the estrous cycle. Slides to follow will talk about the techniques in manipulating ovulation and estrous synchronization, particularly in livestock. So why do we want to perform estrous synchronization and timed AI? So the first reason why we do estrous synchronization in livestock animals is we wanted to group large number of females for parturition. So we basically do this in beef cattle as well as in sheep. If we can focus, for example, the labor and the calving at a discrete period of time, we can also decrease the labor as well as improve the calf survival during this time. We can also reduce the calving season. So for example, in the case of cattle, the calving season is about 90 days. And when we are going to perform estrous synchronization, we can reduce that calving days. When we reduce the calving season, we can also produce more uniform weaning weights when these animals will be weaned. Another important rationale why we do estrous synchronization is that we can reduce or totally eliminate estrus detection. Of course, when we are going to perform estrus synchronization, we can actually predict when the animal will come into heat. So that is why we can reduce or eliminate the labor for estrus detection. This is of course very important also for artificial insemination. But of course, when we do estrous synchronization, we have to keep in mind that these require investment, both in money as well as in labor to get things done. These are the drugs that we are using in order to manipulate ovulation and induce uh, or perform timed AI or estrous synchronization in livestock animals. So the first are the hormonal induction of ovulation. So these are the synthetic forms of PGF2 alpha. We also have the GnRH and the progestins. So of course, when we say progestin, this is a synthetic form of progesterone. We also have those drugs that will induce superovulation. So this includes the FSH, follicle stimulating hormone, and the ECG or the equine chorionic gonadotropin. So let's now proceed to the principle of PGF2 alpha use. So of course, one of the major drugs that is used to manipulate ovulation is the PGF2 alpha. In the 1970s, one of the major advances in the reproductive physiology was the development of the PGF2 alpha. So when PGF2 alpha comes to mind, of course, the PGF2 alpha is very important because it regresses the active CL or the corpus luteum. And it is very important to note that in cattle, the PGF2 alpha is only effective on the day 5 to 17 of the CL or the day 5 to 17 of the estrous cycle. So of course, the estrous cycle of cattle is 21 days. So this is not effective on the following day. So when on day 1 to 4 of the estrous cycle, so that the CL is considered to be not responsive to PGF2 alpha. So the injection of exogenous PGF2 alpha during this time would not be effective for cattle as well as for the ewe and the doe as well as in the mare. Um, this is also not effective at 18 to 21 days of the estrous cycle because during this time, at past 18 days of the estrous cycle, the CL has already been exposed to PG at this time, so the CL has already regressed at this time. This is also non-responsive. The non-responsive period would represent 1/3 of the estrous cycle, so that is 8 plus 8 days. So 1 to 4 is 4 days plus 18 to 21 is 4 days. So that would be 8 over 21 or 1/3 of the estrous cycle is non-responsive to PGF2 alpha. The other 2/3 of the cycle is of course the one that is responsive to the PGF2 alpha, and it is a time where we could make an impact to the CL. So this diagram shows the estrous cycle in the bovine. So estrous cycle in the cow is 21 days. So this is the typical three-wave cycles. We have three waves of the follicular development. So until the time that it will ovulate. So we also have here the presence of the CL. So we have here a high level of progesterone. So if we wanted to get ovulation, so we can give PGF to alpha during this time. So note that this is the period of ovulation in the cow. So this is at met estrus. Now, so a few days later, there will be follicular wave, and the first follicular wave will be at about the development of the dominant follicle will be about day 9. So prior to that, we can give already a PGF to alpha in order to induce ovulation. So giving PGF to alpha at this time will cause the P4 to come down because again, it will regress the CL. Now, and we can get ovulation of the first follicular wave. So note that in the normal situation, this would normally undergo atresia. So this dominant follicle will not ovulate, but it will undergo atresia in the typical estrous cycle without PGF2 alpha injection. But in this case, now this follicular wave can lead to ovulation. Also do know the administration of the PGF2 alpha prior to the normal luteolysis, which occurs at about day 17 to 19 of the estrous cycle. So this is on the second follicular wave when there is already the presence of the dominant follicle. So we can get ovulation at this time. So our understanding of the follicular wave can be used when we can optimally administer our PGF2 alpha. So take note that PGF2 alpha will work on the CL, not on the follicle. The ovulation time will be dependent on the status of the follicular wave, so it is best not to administer PGF2 alpha when the dominant follicle is present. So the next is the principle of the GnRH used in cattle. So again, the GnRH is one of the drugs that is used to manipulate ovulation in animals. So if we have a large tertiary follicle, what a GnRH will do is that it will cause the luteinization or ovulation of that dominant follicle. So basically, when we are going to give the GnRH, first, what it will do is it will cause the ovulation of the dominant follicle. And the other scenario is that it will cause the large follicle to luteinize. So basically, when the dominant follicle ovulates, it will form corpus hemorrhagicum, and later on, it will cause the formation of the CL or the corpus luteum, and that is known as luteinization. So of course, the CL will produce the progesterone or the P4. So if we are going to give a GnRH, the follicle will luteinize, and this will, of course, terminate the current follicular wave. So it will induce ovulation, so it will terminate the current follicular wave. And after that, what will happen is that there will be a decrease in the level of inhibin and estradiol, because these hormones, again, are from the follicle. Another is there will be an increase in the level of the follicle-stimulating hormone in order to recruit a new follicular wave. So the GnRH will not affect the old CL if present. So that is one of the limitations of the GnRH. It will not work on the CL or the old CL. So a dominant follicle must be present to respond to GnRH. That is a requirement. For the GnRH use, there should be a dominant tertiary follicle. So this is generally followed by PGF2 alpha, and of course the purpose of giving PGF2 alpha after GnRH is that it will regress the CL formed or the old CL. So the GnRH is used a lot now for timed AI to induce ovulation of the dominant follicle. In order to do this, there should be no CL that is present. So in order to eliminate the CL, so we must pre-treat with prostaglandin at this time. The dominant follicle must also be present in order for the GnRH to be effective. So one of the protocols that is used now for estrous synchronization or timed AI in cattle is the OVSync. OVSync is a method or protocol developed to control the time of ovulation, so timed insemination can occur, minimizing the reliance on estrus detection. So again, we do this protocol, the estrus synchronization, in order for us to reduce or eliminate the reliance to estrus detection. So what are the components of the OV-sync? So there are three components of the OV-sync. One is the GnRH, then we also give PGF2 alpha, and we then give a GnRH later. So GnRH is given randomly at the cycle. The purpose of this is to eliminate the current follicular wave by causing ovulation or luteinization. Then of course after that, after ovulation, there will be the formation of the CL. The CL is formed and we administer PGF2 alpha 7 days later. And the purpose of giving PGF2 alpha is to induce luteolysis or regression of the newly formed CL and also the old ones. We then wait 36 to 48 hours and give GnRH. And the purpose of this is to induce ovulation of any follicle that continues to grow, particularly the dominant follicle. After that, timed AI now can be done 8 to 18 hours after the procedure. So this method was regarded to revolutionize the dairy industry. So when we are going to compare the evaluation of the OVSYN protocol with dairy cattle, so it is okay with dairy cattle. For the beef cattle, they are better with the other timed AI protocol, the pre-sync and the co-sync. So this is a demo of the OVSYNC in cattle. So here we have the typical 3 follicular wave cycle in cattle, and the CL is present, so that is why we have the P4, and the lifespan of the CL is normal, so it will typically regress at day 16, 17, or 18 of the estrous cycle. If you are going to give GnRH at this time, particularly when a dominant follicle is present, it will then cause the follicle to ovulate or luteinize. Of course, the dominant follicle will ovulate, and this is ovulation, and later on it will form the CL. So take note that progesterone is still dominant during this time. So take note that ovulation at this time occurs at the first follicular wave. So when that happens, another follicular wave will rapidly begin right after that first follicular wave, as the E2 and the inhibin go down. We also have a rise in the follicle stimulating hormone in order to induce the recruitment and to initiate another follicular wave. So the second follicular wave will go up. It will reach the dominant follicle. If we are going to give PGF2 alpha during this time, we will lyse the CL, and of course it will cause the drop in the P4. So of course, the normal lifespan of the CL is about 15 days, and as you can see here, the CL has already regressed because we give PGF2 alpha at an earlier time. So we can give GnRH at this time to enable the ovulation of the dominant follicle. We can also do AI at this point, so no need to check for estrus. So we can do the AI 8 to 18 hours after the GnRH administration. As a recap, this is our OVSYN protocol. So again, we are giving a GnRH at random. So in order to get the animal at day 7 of the estrous cycle. So the purpose of this is we are going to eliminate the current follicular wave and to get the animal at day 7 of the estrous cycle. So at day 7 of the estrous cycle, we have already a dominant follicle. So we can induce luteolysis by giving PGF2 alpha. So of course, PGF2 alpha will lyse the CL. And after 36 to 48 hours, we can give another second injection of the GnRH in order to ovulate the dominant follicle. And after 8 to 18 hours, we can do the timed AI for those animals that are in heat. So these are some of the limitations of the OVSYN protocol. So the OVSYN protocol will only work best on animals near day 7 of the estrous cycle at first GnRH injection. So it should be done when the follicular wave is high enough to respond to GnRH and induce ovulation. So the dominant follicle should be present when we are going to inject the first GnRH for the OVSync protocol. So there are, aside from the OVSync protocol, there are also other ways that are developed in order to synchronize estrus, and that is the pre-sync. Now, in the pre-sync, we can do this protocol. We administer first the PG, prostaglandin, and after 14 days, we can administer the next bout of the prostaglandin. Then after 10 days, we can do the off-sync. Now, so the aim of this is to get the animal to day 7 before starting the off-sync procedure. We also have the double off-sync, which have been reported to get the highest conception rate. So we can do the off-sync protocol 2 times. We also have the GGPG as well as the PG3G. The number here now represents the interval between one drug and the other drug. So the other synchronization protocol, aside from the off-sync and the pre-sync, is the co-sync. So basically, the components of the off-sync and the co-sync are the same. We also have here the injection of the GnRH at random. Then we get the animal at day 7 of the estrous cycle. And after that, we administer the PGF2 alpha and we wait for 36 hours in order to inject the second injection of the GnRH. And after 18 hours, we do the AI. For the co-sync, the only difference is that upon the administration of the GnRH, we actually do immediately the artificial insemination. Another important drug that is used to manipulate ovulation and are used in time AI is the progestogen. Progestogen is a synthetic form of P4 or progesterone. So they provide progesterone, and what they do is they simulate, not stimulate the CL. So they don't do anything on the existing CL. So what they do is that they will prolong the lifespan of the follicle. They will prevent ovulation. So they have no effect on the normal lifespan of the CL, and they also do not regress the CL. So when we are going to remove the progestogen after the animal's CL regresses, so of course it will induce the current or the next follicular wave to ovulate. So because it inhibits the ovulation. This occurs 2 to 5 days later, and we can use PGF2 alpha to regress the animal's CL. So there are various preparations that are available. We have the injection. We also have the progestogen that is available in the feed. So that is the melangestrol acetate. We also have the implant and the controlled internal drug release, or the CIDR, via the vagina. For the implant, we have this in the ear implant. So this is what happens now following the CIDR insertion. So of course, the CIDR will provide progesterone. So this is the level of the P4 in the plasma in nanogram per ml. So the P4 will come up rapidly after an hour of CIDR insertion. So until the CIDR is there, so there will be an elevated level of P4. It will gradually decline over time, but not that much. So this is a depiction of what happens during the presence of the CIDR and after its removal. So after the removal of the CIDR, we can see here that there is a rapid decline of the P4 level until it drops to 0. So we go back now to the normal 3-wave follicular cycle of cattle. So there are 3 follicular waves here. At a typical or a normal estrous cycles, we have here a dominant level of P4, and after some time it will regress. And at the 3rd follicular wave, so there is ovulation when the progesterone has already dropped. So this is what happens when we are going to give the CIDR. We are going to give the CIDR in here. So prior to the normal regression of the CL, so there will of course be a rise in the progesterone level until the CIDR is in place. So the Normal CL will regress on its own, particularly during this time. However, as seen in the third follicular wave, so normally the first we have here the first, second, and the third follicular wave. Normally at the third follicular wave, the the third follicular wave is the one that will ovulate. But because we have here the presence of the cedar, so that the dominant follicle will fail to ovulate. So when we are going to remove the cedar, what will happen is the next follicular wave will go on and ovulate. And at this time, this is already the fourth follicular wave. So therefore, if you are going to remove, if we're going to give the cedar, what the cedar will do is that it will prolong the estrous cycle. So the estrous cycle here is now 26 days. And that is, of course, increased now from the typical 21 days. And of course, we are also going to inhibit the ovulation of the current follicular wave. So this is a diagram of our co-sync, and we actually do this together with cedar. So this is a co-sync plus cedar. So again, when we say co-sync, that is synonymous with sync, but in co-sync, the second injection of the cedar and the AI are performed together or in close interval. So again, we administer GnRH at random, and we get the animal at day 7 of the estrous cycle. Then we give PGF2 alpha. Then after 60 plus minus 6 hours, we give a GnRH and we do the AI for those animals that are in heat. So that is a co-sync. When we are going to administer that together with the cedar, so what we will do is we will give the GnRH injection. At the same time, we will implant the cedar, or we'll insert the cedar in the vagina. Then after 7 days, or after a typical time, we get the animal at day 7 of the estrous cycle. So we give the PGF2 alpha and we remove the cedar. We remove the cedar and we do the AI 60 hours after. So many of these animals will come into estrus already at this point, hence it will be perfectly optimal to breed. We only give a GnRH to cover those animals that did not ovulate. So that's the purpose of the second injection of the GnRH. This is used mainly in dairy cows, and the only problem is whether the cedar stays in the animal. So because this is typically inserted in the vagina. So again, the co-sync protocol is derived, the co here is derived from the Colorado State University, where this protocol was developed. So the cows that come into estrus on the day of AI have higher conception rates now compared to those animals that have a delayed onset of estrus upon the administration of the GnRH second injection. Another protocol is the select sync plus the cedar plus the TAI or the timed AI. So basically the same procedure with the previous one with the co-sync, but in here we also administer the GnRH at random. Then we also give the cedar implant or the cedar insertion at the vagina, and we get the animal at day 7 of the estrous cycle. Then we give PGF2 alpha to lyse the CL. We also remove the cedar during this time, and as the animal come into, it would be a little longer before giving the second injection of the GnRH. So upon removal of the cedar and injection of the PGF2 alpha, we do the heat detection in AI for a period of 72 to 80 hours. So as the animal come into heat during this time, we do the AI 6 to 12 hours after. So those animals or the few animals that don't respond at the 80th hour will be given GnRH and will also be AI'd 6 to 12 hours later. So every responders have a higher conception rate compared to the late responders. So for example, when we are going to compare the conception rate of those animals that have come into heat and AI'd at an earlier time, so that is about 60% conception rate, as compared to the animals that have come into heat during this time and have and are late responders, so their consumption rate is typically lower at 20%. So heat detection in timed AI protocols involves AI 6 to 12 hours after observed estrus for 3 days, then timed AI for all the non-responders 72 to 84 hours after PG with GnRH given at timed AI. We also have the superovulation. So when we say superovulation, that is the increased ovulatory response induced in an individual above the normal range of ovulation rates for that individual. So for example, in cattle, because cattle is a monotocous animal, therefore it is a monoovulatory. Therefore, 3 or more ovulations are considered as superovulatory response in cattle. And we use gonadotropins in order to induce superovulation in cattle. So this diagram shows the normal estrous cycle in cattle, and it also shows the typical 3 follicular wave in a normal cycle in cattle. So we have here the first, the second, and the third follicular wave. We also have here the estrus, and the interval between one estrus to the other is the estrous cycle, and this is 21 days. And of course, during this time, during diestrus, we have a high level of P4 from the CL. So in order to induce multiple follicles to develop, what we do is we give ECG, equine chorionic gonadotropin, 1 shot, or follicle stimulating hormone FSH, multiple shots in cattle at this particular day of the estrous cycle. So this is about day 17 of the estrous cycle. And this will trigger multiple follicle to grow. Now, so that in estrus, there will also be multiple ovulation during the met estrus in cattle. If we are going to start the equine chorionic gonadotropin or the FSH at day 10 of the estrous cycle, which coincides also with the ending of the second follicular wave. So this is our, of course, the first follicular wave, and at day 10 of the estrous cycle that coincides with the ending of our first follicular wave. A few days later, we can give PGF2 alpha, and this will stimulate the follicle to ovulate because we remove again the P4. So we remove this CL here by giving PGF2 alpha so that there will be a multiple ovulation to occur during the met estrus. This procedure is considered to be better time as compared to this one. So again, when we are going to give ECG or FSH, so they vary according to the dose. So usually, when we are going to give ECG, that is only 1 shot. When we are going to give FSH, we give it by multiple shots, again, because of the half-life. Now, so for the FSH, they have a shorter half-life compared to that of the ECG or the equine chorionic gonadotropin. So the ECG here has a primary FSH-like activity, and what FSH will do is that it will induce ovulation just like the uh, FSH. For SHIP, for the estrous synchronization in SHIP, we can use primarily progestin, particularly the cedar. So we can use the cedar in season. So the cedar is effective when the SHIP is in season. So of course, the SHIP is a seasonally polyestrous animal. So we have a particular season, particularly in fall, when the SHIP will normally cycle. When the SHIP is out of season, so when the time is out of season, we can also include ECG aside from the cedar. So again, ECG has an FSH-like activity, so it will induce ovulation. We can also use prostaglandin. So the PGF2 alpha, we can use this for sheep that are in season in order to regress the CL and the when the CL regresses, so the animal will come back into heat again. So going back to the ECG, so again, the ECG is given in sheep that are out of season, aside from the cedar. So giving the ECG will cause the follicle to grow larger so that more estradiol will be released and we get LH surge and ovulation. So that is the function of the giving of the ECG equine chorionic gonadotropin. So in terms of the light is not used that often because again, sheep is a short day breeder. So they breed in the fall. They will require less light in order to cycle. So we can also give melatonin in summer. So the purpose of giving melatonin is to increase, of course, the level of the hormone in the fall and winter. So again, the sheep will cycle in response to high level of melatonin because the sheep is seasonally polyestrous animal, so it is a short day breeder. We now proceed with swine. So in pigs, the prostaglandin is considered to be not practical to be used for estrous synchronization because the prostaglandin is only effective for will only work for pigs at day 12 to 17 of the estrous cycle. So that is a very short window. So that is only about 5 days now of the estrous cycle wherein we can impact the lifespan of the CL. So that is not practical to be used in swine. So instead, we use oral progestins now via the feeds or, for example, so we have here the Altrenogest and the trade name is Matrix. So that is sold, again, the trade name is Matrix and that is usually provided via MGA, melangestrol acetate causing melangestrol acetate in the feed. So, but this melangestrol acetate can cause ovarian cysts so that it is not usually used. And we also have another preparation of Altrenogest is the Regumate. The Regumate is given via the oral route for 18 days. And one of its drawback is its cost. It is typically $5 to $10 per day. And it is an additional cost to the producer. Another way in order to induce estrous synchronization in swine is weaning piglets, and of course, after 3 to 4 days of weaning, so the gilt or the sow will come into heat. For the gilts, we can induce puberty with a shot of PG600. So PG600 is a combination of ECG, equine chorionic gonadotropin, and HCG or the human chorionic gonadotropin. So within a month of expected date of puberty, we can give this drug to cause the follicles to grow, E2 to be produced. So there is LH surge and the animal will cycle and the animal will ovulate. For the mare, we can also use prostaglandin for estrous synchronization. So the mare CL is considered to be more sensitive to that of the cow, so that far less dose is required for the mare compared to that of the to the cow. So for example, 5 ml versus 2 or 1 ml for the mare versus that of the cow. So the prostaglandin is only effective for the mare in season. So equine is seasonally polyestrous animal. So it is a long day breeder. We can also use human chorionic gonadotropin, and this is used for ovulation induction. And this can be used when the follicle will reach a size of more than 35 millimeters. We can also use progestins, and we have under this we have the Altrenogest. The trade name is Regumate, and this is only effective in season. And the purpose of this is that it can reduce estrus behavior, so this will inhibit estrus in competition animals. We also have light, so we must provide 16 hours of light per day for 60 to 90 days because horses are long day breeders.